Okay, let me see if I'm on, y'all. This is a pain in the swing, I'm telling you. So I had to start it over because for some reason I couldn't get the visual up. So that's the reason why I started it over. Okay. So, this is the evaluation and management. This is gonna be part two. And we're just gonna kind of backtrack on a couple of things that we just did. It should pop in a few minutes. So, yesterday, again, we went over some of the modifiers. I don't know if I was mute or not, but yesterday we went over some of the modifiers, and you guys already got some of that. Um, what I was trying to do a little while ago was put my screen, or what you guys know, I always show you my book and show you where I'm at, and for some reason that just wasn't happening. So we're gonna backtrack really quickly just so I can show you where we were at. So this is what we pretty much went over in that other 15-minute chat that I just did. So we're gonna consider this chat too. Um, Again, we're in evaluation and management. Okay. You guys should all have your book. Okay. I'm not sure why this is not. There you go. So you guys should have your book. So again, I have the step-by-step book 2025. You can use your 2026 if you already have it. It's going to be the same type of content. So here, this is what we talked about a few minutes ago. The contents of the E&M, the factors of the E&M, various levels, the E&M coding, and using E&M codes and documentation. I'm skimming through this real quickly because we did this in the first session about 15 minutes ago when we took that 15-20 minute break. I took the break because I didn't see what I wanted to see on the screen, so that's why we did like a replay of this. Okay, so some of you who kind of missed it, again, this is evaluation and management. This is going to be a three-part class. Okay, this is a three-part class. Okay, so we are going to identify factors and E&M coding assignments, differentiate between new and established patients, explain the levels of E&M, analyze code information, identify documentation, and CMS guidelines. So again, we went into more depth on this in that first video. So you guys go ahead and look at that first video. Okay. And here is where you can get your books from, evolveelsevier.com, or you can go to my website and actually get your books. Now, here is where we kind of start talking about what we're going to be doing. And usually, y'all know I make this a little bit small, but I just kind of got it a little bit bigger so you guys can see a little bit better. I'm just dropping aapc.com down there because I want y'all to take a look at that. I want y'all to also go to my website. Feel free to join Sapphire Academy if you choose to. And do not forget to look at my books. I'm also on Whatnot, and again, I mentioned before, some of you guys who ordered something from me, your orders are going out today, and I can upload what's necessary for you guys to also use. So just make sure that you get all the work down that you need to get. So again, in this second segment, the first one, remember we just did it about 15 minutes ago. You guys gonna shoot over to YouTube and check that out. I wanted to put this up because you guys know how I like for you guys to see what I'm showing you. Evaluation and management coding is going to be a few minutes. You know how long it's going to be. It's going to be 3 sections. If you already have your coding guideline book, you can also use that as well. And like I said in yours first segment, y'all can see how these books are similar. It's repetitious. The SBS step-by-step book, step-by-step coding book, the CPC guidelines. Look in those books; they all kind of look the same. So I'm not going to go over too much of that. We did that in the first segment. But I had to make sure that you guys see what I'm looking at. I don't leave this up all the time, but I want you to see what we're going over. So we are now getting ready to go over the gusto in the coding. This is where I'm going to start showing you the coding. Okay, so this is the E&M section. Please make sure you have your CPT book out. We're going to do the new patient. We did this already, 99202 to 99205. You see the difference in the codes between the new patient and the established patient. And remember, we just went over a few minutes ago, but we're going to go over that again. The new patient is, if the patient has not been to the office within 3 years or seen a physician within the group, he's considered a new patient. I don't care if you've been going there 25 years. If you got missing for 3 years, then they're going to put you in as a new patient. And the workup is longer. Okay, the 99211 to 99215 is established patient. The lower the level, the lower the risk. The higher the level, you go in the emergency room. Okay, if you coding something with a 99215, you better make sure you sending that patient to the coding room. The doctor's note should say the patient needs to go to ED immediately. Okay. Telemedicine services, we're going to be going over that. So you see how much important it is for me to drop this up there for you real quick. This is education, so we're not copyrighting anything. You understand? I own these books. This is education, but I have to at least show you guys what I'm talking about. Even though you guys have your books, I still need to make sure that we're all on the same page. Okay. So we're going to be doing hospital inpatient observation care services and initial hospital care, okay? Subsequent hospital inpatient care. Subsequent hospital inpatient care or observation is a toughie. So I don't care if you don't have a table, go to Home Depot, buy you a little 5x7 or whatever, and then get you some 2x3s and make you a table. Because I need you to have your... Okay, I need you to have your space when you are studying. Okay, consultations, emergency department, critical care services, nursing facilities, home or residence, prolonged services. Oh my goodness, that's going to be a doozy. Okay, so case management services, preventative care, non-face-to-face. Go back over the first segment. We already went over this. I'm just kind of dropping down special E&M services, newborn care services. With your CPT book, I want you to look at what I'm showing you against your CPC book. Okay, now I don't know which one. This one right here. So in your CPT book, you should still have the same information that we see here. Okay, took that link down, so I'm gonna go ahead and put that link back up with that book. This one is the step-by-step book, and remember, these are example books from Kindle, so you're not gonna get the full entire book, but you will get some. Okay. Those of you who are my Twitch people, just make sure that you click that link, and you can also get those free books as well. So let's get the step by step in there. Okay, good. So we got that, and I'm also going to give you that Kindle CPT one as well. So again, if you don't have your books, this is a sure way to get you started. This is a way to get you started. Okay, I'm gonna give you ICD-10 as well. Okay. If you are on the TikTok, or if you're on the Instagram and you guys are new to my class, you can always DB me with a question or anything that you need assistance with, because sometimes it's not easy. It's not easy. So, everything takes time, and you're going to have to use your studying time to do this. I don't want you guys to get into a predicament like Kim, where she's, stressed out. But she doesn't even know it. She's going to pass that exam. She is. She's going to pass that exam. I don't care if she take it 10 times, she's still going to pass it. Okay? Same thing with you guys. Okay, so evaluation and management is definitely going to be fairly long. Okay, I just want you guys to see other E&M services. Other E&M services, those are the codes for the other E&M services over there. Okay, but I want to make sure that you clear on how we start to do the E&M coding. And again, some of you might work in a doctor's office. and not, work in a hospital facility. Okay, because I am going to do a little segment on the PCS coding and some of the hospital codes, so y'all can kind of get the gist of that, just to kind of see. You can go in there and you can tell your managers, and I've been introduced to ICD-10 PCS. I don't do a long class on ICD-10 PCS, but I do show you what it is, what type of coding that is. Okay, so I was talking about the other E&M services. I was just waiting for that to pop up there, 99499. Okay, so in E&M, you guys know we code by time. So here, I just threw that in. But here, I'm going to show you 3 factors of the E&M coding, which we did on the prior slide. So you got your place of service. Okay, where was it done? Type of service. What was done? Patient status. Okay, how severe it is. Okay, I'm gonna go through all 3 of those anyway, and I'm gonna put it in their form of how they want you to recognize it. So place of service is if the patient is in a hospital, if the patient is in the office, maybe they went to the emergency room. And make sure you read this, read between the lines and read everything that's in here. The second factor is the type of service, which is what? Consultation, maybe admissions, maybe it's newborn care. Okay, and here at the bottom where it says it's giving you the definitions of what they want. Okay, I want you to make sure that you read that. Okay, especially if you guys are new and have not done billing and coding before. Okay, patient status, new patient, established patient, outpatient. Okay, this is your beginning to doing the E&M, evaluation and management type of coding. Okay, and I'm just stopping right there. Your test that you're going to take, your exam for your certification, like I said, they want to know if you have gone through these books step by step. Have you learned what you need to within these books step by step? That's the reason why they call that book step by step. It's tough, and there is a lot of stuff in there for you to learn. But again, with evaluation and management, take heed to those 3 steps, and you will be fine. When they say patient status, they want to know whether it is a new patient, established patient, outpatient, or inpatient. Just kind of backtrack and look at those codes up there, and you will get used to that. But we're going to go through the whole thing so that when you get ready to start coding, I want to at least make sure that you're not getting like 40s and 50s or 60s. I'm okay with 65s. I just need to make sure. If you don't pass that test, then I'm not doing my due diligence. You see what I'm saying? If you're not getting what I'm giving you in this classroom, then I'm not doing my due diligence. I need to bump up my game. You ever heard of that expression, let the master answer? If you're a supervisor or you're a manager and your billing staff is off the chain and they're just not getting money for you, you need to do something. You need to make a change. And you guys know that I always make change if you guys got something that you want to add in or something you want me to add in. You guys let me know. So again, just pay close attention to what you're doing. So here they also have exercises in that step-by-step book. In the step-by-step book, you won't have any large cases in there like you will have in the Sapphire Academy. But I did put cases in there for you guys to do. This is for YTU. So YTU, you have cases in your CPC guide. So if you actually have that CPC guide, there are cases in there for you to actually study. Okay, so let's take this down. So I'm just going to take this down real quick. So in evaluation and management, a lot of what we went over in the first segment. So let's just go over this little part right here where it says your medical records. So I'm on page 276. Patient information is located in the medical record. Okay, and that's your gusto. So some of y'all that's new, that have not coded before, or need to have your start, this is your start. So you're going to read this as you do your studying. Patient information, okay, which is what it's about. It's about patient's information, right? That is inside of the medical record or the doctor's notes. This is referred to as documentation. And when you code, you're coding from documentation. If it doesn't say the information you're listing in your coding and documentation, we always have a saying, it didn't happen. So pay attention to your documentation, okay? Because documentation, in the medical records, we use it for everything. We use it for everything. That's why they made the Epic, because it's so much easier to track patients' health and what the providers are doing with the patients, okay? Okay, so documentation medical record has many uses, such as evaluation of the patient's treatment and communication. And you guys already know that how important it is with documentation. Okay. Regarding the patient's health, reimbursement claim, review of the use of the healthcare facilities, research, we use it for everything, education, CPC, see all those cases that are in CPC, they're actually real cases. That's a patient's medical record that they use in the CPC guide. Okay, I mean, of course, you have permission from the facility and the provider. Okay, 7 organizations. 7 organizations, okay, this is very important, developed minimum documentation guidelines. Okay, I'm not going to read through the whole thing, but you guys are going to do that. I'm going to put this up just so you guys can see it. So this is very important right here for you guys to see this, okay? Because those documentations, that is what the certification is about, to make sure that you know all about those certifications, okay? And make sure that you understand the rules of the certification. You see these entities right here? AMA, Managed Care, Review Association. They're very important. These people make the rules. They want to make sure that we as coders follow the rules. We as revenue cycle management follow the rules. Okay? And that's what the AAPC certification is about. Making sure that you have read and gone over all of the material that you need. The CPC guide puts all of this stuff in a nutshell for you, to make sure that you pass your certification, your CPC, Certified Professional Coder. Okay, that's why I want you to have this book, your CPC, and your CPT. Just like how I have these things around me, in order for you to be a person who's going to retain what you study, and you have to have everything in front of you. Because if you make a note in one book, you need to make a note in that book. That way you can rush back and you can get it. So, just kind of letting you know that, okay? So, again, these entities are very important. Medical documentation, like I said, if it's not in there, it didn't happen. But these 7 organizations are the people who make up the minimum documentation guidelines that you can see. So, you are going to go over this. I like this one down here. The CPT and ICD-10 CM codes reported on the insurance claims or billing statement should reflect the documentation in the medical record. So, those of you who have never coded before, this is what they are talking about. This is the gusto. In coding, we make sure that we code from the documentation that is in the patient's medical record, the documentation that is in the reports that the provider has done, the documentation that is in the notes that the provider has given us. So, it's not that hard. I know sometimes I say coding, people, sometimes they kind of steer back. Oh my God, I can't do it. Yes, you can, because everything has an answer. If I give you a question about a code, if you're taking an AAPC and they give you a question about coding, and they give you a case, the answer is in the case. The problem is, you have to have enough of time to get it. You know what it is, but you have to have enough of time to do it. So that's why I always tell you guys to do the open and close questions first, so you can have as much time as you need to do the cases. Okay? So the medical record should be complete and legible. Documentation of each encounter should include the date, the reason for the encounter, appropriate history, physical examination, review of auxiliary services. Now, this is pertaining to medical office services that I'm talking about now, and hospital, because you have clinics in the hospital. But to keep you on the right track, take your index cards and put what you see from 1 to 10 on there. Sometimes you're just kind of chilling, you're just kind of hanging out, and you want to kind of review what you're doing. Make sure that you put them on there, okay? A written plan of treatment. They're telling you what documentation is right here. Okay, a written plan of treatment and should include when appropriate treatment and medication specifying frequency. This is just giving you the medical record of the patient. Okay, not necessarily the notes all that you need to do your coding, but you still need to have medical billing knowledge as well. Okay, office or other outpatient guidelines, medical decision making. The elements of medical decision making remove the focus of adding up tasks and now focus on the elements that affect the management of a patient's condition. Affect the management of a patient's condition. You see how important the medical record notes are, especially in the doctor's office. I think a doctor's office is a lot more easier than working in a hospital because if your doctor's office is a specialty, you gonna bust right through that stuff. Boom, 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 boom. You see what I'm saying? That's why, like when people say they want to go, because y'all know I'm a physician office, but I'm still in the hospital too. Because most of my doctors they got to do their surgery there. You know what I'm saying? So don't get scared. Of those entities that you have to do, especially that it has to do with evaluation and management. Okay, because evaluation and management, you have to be able to read the documentation. Okay, so that medical decision making is MDM. If they give you a question on your exam that says, what is MDM? Medical decision making. Okay, put it on the index card. Okay, that's going to help you to remember it. And here, basic elements of medical decision making. I think I got the 1997 or either the new one. There's a format to this that we do in another class. Hold on, let me put it up. There's a format to this that we do in another class where I make sure that you understand what this is. Okay, this is how you're going to decipher the level um, of coding and decision making for the patient. This form here, I have, see, I can't put those type of things up here. You have to be enrolled in the Sapphire Academy in order to get that for that class. That class is not taught here, but you still can read this and get the gist of what it's about. Okay, so again, you see where it's 99202, straightforward. Okay, it's a straightforward 99203, low, moderate, and high. And if you can see, you see how these codes are going up. So the higher they are, the more severity that it is. And again, in this classroom, this I don't have a full class for this here for you guys because this is just white to you. But let me put. I don't know if I'll put this down on Sapphire Academy. Let me put this down. You guys go check out my website, and if you want to join the Sapphire Academy, you can. You just get more work in there, and I give you more tasks to do, and you also get cases and codes in there to help you pass your test. On the YTU, we have to be more just general. I just have to just put you in the right place here, but you still get something out of it. And again, you can have access to that material that I have. When you go in my bookstore, you just pretty much downloading everything. People must be off from work today. All these messages I'm getting. What's today? Is today a holiday or something? I don't know. People must be home or something. Okay, so again, evaluation management is long, and this element of basic medical decision making, you'll be able to get it. Just read it. It says to qualify, 2 of 3 elements of MDM must be met or exceeded. Okay, must be met or exceeded. And that's this chart that I just put up there. I just took it down because I'm not supposed to leave it up there more than a couple of seconds, but depending on which screenshot that we're using. Okay, let me just put it right here. I'm just gonna slide this up just so you guys can see where I'm at. So I'm talking about this chart right here, and again, it's not even that big of a deal because what you get in the Sapphire Academy, I give you an example of this, and I give you a worksheet that you're going to use with this. Okay, so you can find your codes, and I think in the CPT book, there's also some exercises in there on this. Okay, so again, just take heed to it. What I want you to do, what I want you to do in your studying, If you have your CPC guide, I want you to combine your CPC guide with this and with your coding, your coding book. Okay, so let's talk about time. Do not forget, evaluation and management mostly is based on time. When you take your CPC, don't get scared when you see that exam. When you get to evaluation and management, that's going to be open and closed questions. You're not gonna have a long case in evaluation and management. I want you to hit that and keep it moving. Hit it, keep it moving. Okay, because I need some of those seconds for you to use with your longer cases. When you get to cardiology, that's when you really get scared. All right, when you get to musculoskeletal system, that's where you're gonna get scared. I don't think integumentary is that bad. The rest of them is a breeze. Okay, the cardiology might give you a flip. So that's the reason why I want you to make sure you breeze right through E&M and breeze right through medicine, because you could just see. I mean, if you're in an office and you're in medical, medical billing, you're not going to go to the doctor's office and be there 3 hours. Yeah, all right. You ain't gonna see the doctor for 3 hours. You might be waiting for a minute. The versus getting a hip replacement. You talk about 12 hours standing there. You understand what I'm saying? If you go to the case in a hip replacement versus a E&M service or medicine service at a doctor's office, you talk about boom. Okay. So I know y'all know I get carried away. So here again, just pay attention to this. To qualify for two of the three elements as in codes of MDM must be met or exceeded. You have at least two. Okay, so when you reading those notes, that's what I'm talking about. Now I can't go too in depth with that. You'll have to join Sapphire Academy for that. But I'm still putting you in the right place. Time may be used to report office or other outpatient services instead of MDM. Okay, total time is used to report the code. I'm reading fast because I know you guys are reading it too. All right. So again, just pay attention to what you're doing. So if you have 99201 deleted to report use 99202, that means they ain't using that no more. They change it. That's what that means. Okay. 99202 15 minutes, 99203 30 minutes, 99204 45 minutes, 99205. So you're not going to use all these different codes. You're going to use the one for the that reflects the minutes. Now, in time is doozy because it's a certain amount of roundabout in time. When we get to the medicine section, I'm going to show you more in depth of what I mean as far as time and roundabout. Go to Sapphire Academy, join, use this. I think I got a promo going on YouTube. Use that promo for $59 so you can get into the academy. Because some of y'all done slacked up on the academy. I want to see y'all going in the academy more. Okay, it's the end of the year, and that's mostly time when my students are taking their tests. But I still should see y'all in there more. Okay, so again, time is something that you're going to make sure that you have exact. Okay, because that's why I want you to make sure you use your calculator when you get ready to take your test, because they're going to want time to be specific, and I'm telling you that's where you're going to get stuck at. You're going to spend a lot of time on that. Okay. Established patient. Okay, so I don't know. The first one was a new patient. The other established patient. Kind of almost like the same thing, but that when you have a new patient, you're gonna spend more time with the new patient than you are with an established patient, because with the new patient you have to do a rundown, so it's gonna be more money. Um, this is just giving you the differences in the times for those two. Okay. As you can see right here, let me show you. You see with the 99212 is 10 minutes, and then 99202 for the new patient is 15. So, right there, it tells you right there you want to spend a little bit more time. But, again, these things you're going to get used to. You're going to get used to. For services of 55 minutes or longer, see prolonged services code 99417. Okay, if you got your CPT, but go there so you can check it out, see what it says. So time is going to include these type of activities, y'all. So you guys go ahead and read this section. Performing to see the patient, obtaining review, counseling, referring, documentation, care coordination. I'm not reading the whole thing. I'm just kind of breaking it down. All right. So I want y'all to still go here. Go to prolonged services 99417, 99418, and then I don't know if you got your Hicks Picks book. Okay, don't worry about that. Just go here. Go here. Okay. If you do, then I want you to go to G2212. Okay. Just to look at it. You're not gonna do nothing else when you just looking at it. All right. So you have a little bit of an exercise right here, but what I want you to do is still go over what we did. That's going to be your homework tonight. Okay, go over what we did, especially as far as the E&M service time, new patient, established patient. Okay, and this I also want you to go over as far as the elements. Okay, if you get stuck, you're gonna have to go to Sapphire Academy. Okay, and you guys can also give me a one-on-one if you want. Okay, so again, these are going to be the various levels of E&M. Now remember, I was talking about the key component in the other video. This is where this is going to come in at. Okay, the levels of E&M services are based on documentation located in the patient's record, various amounts of skill, effort, responsibility, the knowledge that the physician used. Okay, the patient selecting the E&M service, same thing, E&M, but here when we start talking about the key components, the key components is how you're going to do your coding. Okay, so medical decision making is what? MDM, don't forget that. The key components of medical decision making reflects the clinical information. Now, when they say that, they're saying just like when you make a cake, when you put all the ingredients in making a cake, you need certain components, you need certain type of ingredients. It's the same thing. Here you said number of diagnosis, risk complication, what data you're going to review. It's the same thing. And remember how we looked at the chart, right? Medical decision making complexity. Complexity is how difficult it is. So you have straightforward, low, moderate, high. That's why I want you guys, those of you who really kind of into it, you really want to kind of do your CPC and your coding, join the Sapphire Academy. There's tons of stuff in there that's going to help you pass your test, and you still get a one-on-one with me. Those of you who are on the Twitch and have never done this type of coding before, because some of you guys come on and think it's a different coding that you do. This is a different type of coding. It's medical coding. But again, your homework is going to consist of what we just went over in evaluation and management. Yeah, you're going to need your step-by-step book. You guys have any questions for me? I'm gonna pause for like 2 minutes in case somebody wants to jump in and ask a question. But most definitely, when you start your coding career, it takes a lot of reading. It takes taking notes. It takes a lot of patience as well. Okay, I don't want you to crash and burn out. All right, don't look at it and go, I ain't get it. I ain't get it. Do it again. If you don't get it, then you do it again. If when you join AAPC, when you join the AAPC, you'll have access to those tests. AAPC has tests that are like $10, $15 to test yourself. These tests have answers, and the answers also have the rationale. The rationale is why this answer is what it is. Even I think in the CPC book, they should also have the rationales in here as well. Let me see. They did. Yeah. So the rationale is also in the rationales are also in the CPC guide. So what I mean by that is when you get your CPC guide and you take one of the tests that are in here. This is more advanced class. We haven't gotten up to CPC yet, but when you take one of your tests in there and you go to the back of the book and get your answer, the rationale is there. That is what I want you to make sure that you understand. Because if you answer a question and you get it wrong, then you look in the back of the book, okay, fine, get your answer. But I want you to know why that answer is what it is. Okay, that's how you're going to pass your certification, your CPC. Now, because evaluation management is it's a longer section. Again, we're going to do it in three segments. What's today? Wednesday, Thursday morning will be your second segment. Um, if you don't have your step-by-step book, go to that link that I put on the side so that you can get your sample of the step-by-step book from Kindle. Okay, so all you have to do is, I think, sign up for Kindle or something like this on Amazon. Okay, and your CPT book, they have that there too. I'll put the link up there for that as well. CPT, oh yeah, there it is. Okay, so there's the CPT, the ICD-10, and I put the step-by-step book up there. That's because you need that. It'll be kind of hard for you to do the class without it. But, here is where your gusto is going to be. You see where, it says straightforward, low, moderate, and high. That's how they do the medical decision making. That's why for you to have both of your books, it gives you more information. You're gonna get that quicker, because on your exam, that's going to be more or less an open and closed question. 99212s, 99213s, those are more open and closed. I want you to go in and go out. And exam now is only 100 questions. Um, Taking it online, I think is cool, but I would rather take it in person, and just in case you fail, you get to take it again free. Okay, it ain't free, so you already paid for everything. But taking your exam in person is better. Okay, so again, here they're going to explain to you what these medical decision makings mean and what these levels mean. Okay, this is how we do the coding for the office. This is how we do it for the office. There's actually a sheet that you're going to get. Well, you guys have to join the Sapphire Academy to get that, but you still can get insight on what's right here. Here is where it's kind of putting you in the right place and letting you know how we code doctor's visits, how we code medical office visits, and what straightforward decision making is. In your CPT book, it has the same type of information there, because the CPT book, it's really your guide to coding. That's where you get your procedure codes from, right? Because ICD-10 is where you get your diseases from, right? Then we go over that, and then we get, then we do the CPT. That's where you get that information from, right? Okay, good. So here, this is where we're going to kind of identify the complexities of what's going on with the patient. You guys remember I said the high complexity on decision making would be like the 99215. The patient probably needs to be admitted to the hospital, or they need to go. So high complexity decision making, extensive diagnosis and management options, extensive amount and complexity of data to be reviewed, and high risk to the patient for a complication or death if the problem is untreated. So you could see the higher severity and what needs to be going on with the patient. Let's look at the more straightforward decision making. This has to do with the MDM. This is how we're going to do, how we make a decision. Okay, and again, this is y'all's homework for later on. So don't worry about me going through it thoroughly. Y'all are going to go through it thoroughly. Okay, straightforward decision making. More or less 99211 or 99212 is a little bit smaller. Okay, minimal diagnosis and management options, minimal or none for the amount and complexity of data to be reviewed, and minimal risk to the patient of complications or death if untreated. Now, on your CPC, you're not going to be able to have this, it's in your book, but I don't want you to have to go back and read it. There's a small chart in the front of your CPT book, and it has the levels in there. So if you kind of just review those, just like how you do in your regular studying, you don't need to go back and forth to it. You'll be able to go ahead and knock that question out real quick. Okay. Okay, so low complexity, limited number of diagnoses. Straightforward is minimal number of diagnoses. Moderate, 99213, possibly multiple diagnoses and management options are moderate amount and complexity. Okay, they're all going to say death if untreated. Okay, number of complexity of problems. Now, in this sheet, I can't think of what the name of my sheet is. I got a 1999 and what is it, 2020. I think it's 2000. Those are the sheets that you're actually going to code your MDM by. I think I actually do have one in one of my chats. So check out one of my chats. I think the sheets are in there that you're gonna code by, because it's not you're not gonna code it right off of your head. You have to code it by using the terminology in that data. Okay, and that's an MDM. It's gonna show you what this is. Um, there is a class on it in the Academy class, but I think I do have a chat for you guys that are in YTU on the YouTube. Okay. Um, She count, okay, data to be reviewed, risks, comorbidities. Comorbidities are secondary conditions that you could die from. Medical decision making risk of complication of morbidity and mortality. These two words right here, morbidity and mortality, make sure you write down the definitions of one and the definition of the other one. Morbidity is causing death, mortality is death. Okay, write those down. Okay, they look too much like the same. You may have an issue with them. Okay, so I'm on page 282. Levels of risk presenting. For this is the sheet right here. But tomorrow morning I'm gonna see if I can put the sheet up there so you guys can see it. It's actually an MDM sheet that you're going to do the coding on. Let's see if I can put it up here. Even though I think I have it in one of those other chats, I think I can still pull it up on here for you guys. But it's similar to this. You see how it's saying minimal level 1? So in order for you to code a minimal level 1, this is what needs to be wrong with the patient. Not necessarily this, but they're just showing you. So if the patient comes in with one self-limited or minor problem, use minimal level 1. Now I'm going to backtrack. What was minimal level 1, y'all? I'm backtracking. I can backtrack to right here because you guys can still see what the minimal is. But I thought we had something that had like level 1, level 2. See, we got it as in straightforward, low, moderate, high. I'm going to consider it the same thing, low, moderate, high. I thought it had level 1, level 2. But you could tell by it staying straightforward, low, moderate. Now 211, 212, 213, 214, up to high 215. All right. To use a level 2. Okay. Now this is going to be between your 1-1 and your 1-2s. 2 or more self-limited or minor problems. 1 stable chronic illness. Okay. Moderate. 1 or more chronic illness with mild I can't say the word exacerbation or progression. Okay. That word I just told you, EXACERBABH, exacerbation, that means that it's getting worse. Okay, whatever the issue is, the issue is going to get worse. It's like something persisting on. Okay, 4 is 1 or more chronic illness. Now, the data in the report, the data in the sheet tells you this. I don't know why they don't give you an example of a sheet. Oh, I guess they are, because this is really the example of a sheet right here. You see how this is? You're going to have a sheet like this to code by. Okay, when you're in the facility, you can have a sheet like this to code by. Because this is how we do it. We write it on here, and that's how we get the code on it. But when you take your test, you're not going to have this, but you're going to have a sheet like this in your book. Okay, you're going to have a sheet like that in your book. Okay, what time is it? 2:24. 12:24. Okay, we got 6 minutes on this one. All right. So number of diagnoses, minimal, low, moderate, extensive. It's kind of hard for you to actually see, because you need to see you need to have a real sheet in front of you. So it's kind of hard for me to do this portion of the class right here online. I'm trying to figure out how a better way I can do this. I could do it plainly, that's inside Sapphire Academy, but I'm not able to give you guys in YTU the full explanation of how you're going to use this sheet. I mean, it's self-explanatory as far as the risk, but those of you who are new to coding, this is like ebonics to you. You have no idea what I'm talking about. I have to express this a little bit different, so that you can get this. It's decision making, but in order for you to get those codes, you need to know how to work the sheet. So what I'm going to do is, now we ain't moving on no coding shot. I'm gonna upload the sheet, which I do have. I have this sheet in one of my chats. I don't know which chat it is. So what I'm gonna do is I'm probably gonna upload the MDM sheet, and you guys can print it out. Okay. On YouTube, don't they have where you can print from YouTube? So I don't know. They do. I think you can print from YouTube. So I'm gonna try to upload that sheet on here because there's no way that you guys are gonna be able to decipher this without looking at that MDM sheet. This is actually an MDM sheet that's on here, but they got it broken up in two different spaces. You can't tell, what they're can't tell what they're looking at, especially if you're new to the class. I'm trying to figure out if there's one in here. Then see, this is a piece of it. See how this is like this? This is a piece of it. It doesn't show you like the whole thing. So I'm just kind of scrolling down. Don't do any of those tests. We're not doing none of those. All right. So we're not even up to direct face to face. So we ain't doing direct face to face yet. I was trying to see if they had one in there. All right. So I don't really see one in there, but you still can get the gist of what I'm talking about. We're not gonna move on to face to face. That's gonna be tomorrow after I try to load the sheet for you guys. So just take heed to the levels of the coding, right? Levels of a coding. I mean, you can take a shot at it if you want to, but I don't want you to do what's on the bottom. All right. 1, 2, 3, and 4. You can take a shot at that. All right. But no, when you select one of these 4 types of complexity of medical decision making, straightforward, low, moderate, or high, the documentation and medical record must support the selection. And you already know that, so I really don't have to read that to you. If it's not in the record, you can't code it. How could you code it if it's not in the record? So that's how you know whether you're going to be right or wrong. Okay? So again, this is okay. But I think you need to see the full MDM sheet to understand what I'm talking about when I'm talking about coding office visits. I got one in here. I know I got to look at my thing. It's in your YouTube. I mean, I should have one in there. There's a chat that's in there that says, it should say MDM. So when I find it, I'm going to, of course, attach it to this link below. But, I want you guys to make sure you read this section. Am I still up? Yep. Diagnosis and complexity of problems, data to review, and risk. And establish patient outpatient medical record. That's just giving you an example of medical records. Okay. Giving you an example of what you're going to see in there. All right. So I want you to, I got 1 minute. I want you to stop right. If you guys want to try to do these, that's fine. This is some of my other coders that already is coding. You see these cases down here, these little small cases like this. These cases are so small, they literally open and close. If you want to read them, you want to mess around with them, you can. Okay, but we're going to do this tomorrow. Stop here. Stop where it says from the trenches. What's she at? Direct face to face. So that's where you're going to stop. Right now, we need to get this. We need to get this down. We need to make sure you guys are clear on this. So what you guys are going to do, you want to read this. I'm on page 286. You're going to read. You don't have to do these cases. I don't really want you to do those. You can just kind of read them and do them if you want to, if you can. So we're going to go back over this. Everything you see me scrolling up. 99212, billing on time, 10 minutes, report 99212. Start again. So you can understand those 3 codes and why, okay? Why you're going to use the medical decision making. Read that. Key components. Now, as far as the key components, I want you to open your CPT book and look at the key components in the CPT book, even though we saw some in here, okay? even though we saw some in here, I want you to also look at them. Okay, so when you get your book, make sure that you look at them as well, and go get the free book. Okay, go get the free book and you can see them. Okay, so what time is it? Okay, it's 12:30. So 12:30, we're gonna shut this down, and then we're gonna come back on. Okay, and we're gonna come back on probably tomorrow about 10. I'm gonna say 10:30. You don't see me at 10. You know I'm gonna put 10:30. I haven't put the thumbnail up there yet. Okay, but let's take this down. If you guys, like I said, if you guys got any questions, give me a discussion board. We're gonna talk about it. Evaluation and management is kind of long. All right. So if you got your CPC guide, I want you to go to. I know I'm moving ahead. This is we ain't supposed to do this till the end, but I still wanted y'all to go. I think it's 247. Go to page two. Nope. It's 257. Go to page 257, chapter 15. So I want you to also go over that as well. It's pretty much what you're doing here, but it gives you a little bit more insight. Okay, so